In warfare, the first target is always communication. Break the command systems, and the entire operation collapses. Last week, that exact scenario unfolded inside of one of America's major healthcare systems. A massive ransomware cyber attack struck the University of Mississippi Medical Center, shutting down critical hospital systems for 9 days. Electronic health records, gone. Scheduling systems, offline. Clinical databases, locked. Surgeries were canceled. Procedures delayed. Clinicians forced back to paper charts in a digital battlefield. And when the screens went dark, the front line had to keep fighting. This is the part the public rarely sees. When hospital infrastructure collapses digitally, the burden shifts immediately to clinicians, nurses, physicians, therapists, pharmacists, and technicians suddenly have to make life or death decisions without the information modern medicine depends on. No medication history, no allergy alerts, no diagnostic trends, no previous lab data. Imagine treating a critically ill patient while flying blind. Now imagine doing it across an entire hospital system. That's not inconvenience. That's patient safety under fire. And this is where the conversation must change. Too often, cybersecurity in healthcare is framed as an IT problem. It's discussed in boardrooms as software upgrades, firewalls, and technical budgets. But on the floor, clinicians know the truth. When hospital systems collapse digitally, care delivery collapses with them. Medication errors increase. Communication slows. Documentation becomes fragmented. And the entire safety net medicine relies on begins to unravel. Cybersecurity is not an IT issue. It is a patient safety issue. And it is a clinical operations issue. And increasingly, it is a national healthcare infrastructure issue. Hospitals today operate like modern command centers. Electronic records guide medication safely. Digital imaging drives diagnosis. Real-time monitoring protects the unstable patient. Remove those systems, and clinicians are forced to operate under conditions that modern healthcare was never designed to sustain. Yet, despite the rising threat, many healthcare professionals receive little to no preparation for this reality. No operational training, no emergency protocols, no infrastructure resilience. But when the system fails, the front line still carries the mission. This moment should serve as a wake-up call. Healthcare is not just vulnerable to disease, staffing shortages, and financial pressures. It is increasingly vulnerable to the digital warfare. And when the servers are attacked, the people standing between chaos and patient harm are the clinicians at the bedside, which raises the question healthcare leaders must start asking. Are we truly protecting the systems that protect patients? Because resilience in healthcare isn't just about buildings, budgets, or technology. It is about preparing the people and infrastructure that keep caring, moving when everything else fails. The front line will always adapt. They always do. But adaptation should never be the strategy. Preparation should be. Healthcare cannot afford to treat cyber attacks as isolated IT incidents. They are operational threats. They are patient safety threats. And if we ignore that reality, The next hospital that goes dark won't just be an inconvenience. It will be a crisis. The mission now is simple: strengthen the infrastructure, protect the clinicians, protect the patients. Because in healthcare, when a systems fail, the front line still has to win.